Okay, good morning, and it's time for your health check. Last week, I introduced you to UT Southwestern's Center for Depression Research. A major component of their work happens inside schools, and the goal is to get teens talking about mental health, to teach them how to seek help and to ultimately save lives.
In Texas, suicide is the third leading cause of death among people 15 to 24.
We wait too long, and that is why we get struck when there is a lot of depression, suicide, because it remains hidden.
That's why Dr. Madhukar Trivedi and researchers at UT Southwestern want to change the way we all approach mental health challenges. They're focusing on 8th through 12th grade campuses with a cutting-edge, evidence-based program called YAM. It stands for Youth Aware of Mental Health.
We now have in the North Texas area reached about 25,000 students.
YAM started as a research project in Europe in response to rising suicide rates. More than 85,000 teenagers in 16 countries have now gone through the program. Study results found YAM reduced new cases of suicide attempts and severe suicidal ideation by half. New cases of depression dropped by 30% in young people participating in the program.
We are saving lives.
Dr. Toby Fuller is in charge of the school-based mental health program at UT Southwestern.
We train school partners, school counselors, school teachers who want to do this program and make sure that it is sustainable within their school or school district.
YAM facilitators conduct the program inside classrooms over 5 sessions, 45 to 60 minutes each. It's not only for youth identified as at risk, and it's not a counseling session.
They are more willing to open up to their friends than they are to an adult.
YAM is unique in that it's student-led. Through role play and open dialogue, teens bring up real-life situations and problem-solve together.
And we want them to focus on 3 things. How would you feel? What would you do? And what could happen next?
Equipping them to help themselves and others, and to get comfortable talking about depression, anxiety, and suicide for generations to come.
We are changing family trees and family trajectories.
YAM is approved by the Texas Education Agency as a suicide prevention and intervention program. You can learn more at YAM, that's YAM.org.
And you were saying that they are still following some of these kids who've gone through the program.
Yes, they are following them. This is a long-term research project and really the gold standard of research. And so they're already having success, and that, of course, gives you inspiration to keep going.
And you think about those kids too, learning some of those skills and that mental health awareness, they pass that to their friends, and hopefully there's a trickle-down effect as well.
Yes, and to their families. A lot of times these young people don't have the space to talk about mental health in their homes. And so that's what's going to make the difference long-term in terms of generationally. Yeah.
Okay, really cool. Thanks, Sonia.